All right, everybody, back with another one. Today we're going to be taking a look at RFK Jr.'s confirmation hearing for the head of HHS. Um, I think this is coming down to the last few confirmation hearings with RFK Jr. and a few others, Kash Patel being one of them, I believe. Um, I think it's probably going to come down to him and Kash Patel for the most difficult confirmation hearing because these two people will hold some of the most important positions in America. And for the establishment that wants to see the country go a certain way and to have certain powers and controls over the people that are unconstitutional, um, these two positions give them that ground. They give them that power. And so I think there's a lot of people in certain corporations, especially the pharmaceutical companies, in the medical industry, in healthcare in general, at a governmental level and at a private level, that really do not want to see somebody like RFK Jr. get confirmed, because then he would have certain powers over the whole system that they've been manipulating and controlling for so long. And they've worked so hard to get the state of health in America to the point that it's at. And, um, you know, not like I've said in the past in many videos, not everything is a conspiracy, but there are some conspiracies that are actually true. Conspiracy really only means that two or more people conspire together. They plot and plan together to do a certain thing. And so it's clear that the government, which makes sense that the American people should have never left this in the hands of them to begin with. The government does not have the authority over our health. We have that authority. But over time, our rights have been eroded, and we've given up more and more power to the government to, dictate certain things and have controls that they've never had before. Not to mention they have major influence with lobbyists and just, the way that they've reworked the medical industry. Doctors operate a certain way. They no longer are physicians that, treat people on an individual level and treat the whole body. Instead, they treat people on a symptom basis, and they typically always prescribe a medication, which had never really been done before throughout history, throughout the thousands of years that doctors have been, helping people. In fact, I think I've mentioned this in past videos. Like I said just now, too, we used to call them physicians. And now they call them doctors because they are, basically re brainwashed into being a certain way. They're very academic. They're very much, you know, now it's coming around where there are more and more doctors that are integrative, but they're very much isolated to pharmaceutical and Western medicine versus alternative medicine, which used to be primary medicine. Um, and, now they're just going through the motions. They're just there to get their, paychecks and pay down their massive student loan debt from getting medical degrees, which, again, never used to be necessary. There never used to be, doctors didn't have degrees. Doctors were just people who were physicians, and they studied medicine, they studied nutrition, they studied the human body as a whole and how it operates and how the different organ systems and things like that interact with each other. And they were able to help people a lot better in certain ways back then. Yes, we, definitely need Western medicine today. I'm not against that. Obviously that shouldn't be the go-to for the initial. The initial should be overall wellness and maintenance of the body. And that's something that we as individuals need to practice ourselves every day. But when things go too far and there's not much that herbs and natural nutrition or diet can do, then yes, absolutely, Western medicine is a miracle from God that we are able to, have a doctor or a team of doctors, either themselves or now with robotics, surgically cut you open, remove an organ, rewire your systems to continue to operate the correct way, and you can go on living your life for decades more after that transformation. That is a miracle. So, this channel is not against Western medicine, but I think everything should be interwork together. Alternative medicine, which again, like I said, used to be just primary medicine, and new Western medicine, which is more modern over the last 150, 200 years, should be combined together to really help people heal. And the fact that the government and the pharmaceutical industries and the medical industry and the healthcare industry as a whole has worked so hard to separate those two shows that there is a clear conspiracy. There's a clear agenda to have human beings remain sick, but not sick enough to where they die, just sick enough to where they're ill and need to continue to buy their products or, have their services, go to the doctor routinely. You're paying them, the insurance company's paying them. That's cash flow for them. It's a business strategy. And I think a lot of people today, they are, especially the boomer generation, this is a big thing with them. They're so naturally trusting of the institutions that we've known in this country for so long, the education system, the medical system, things of that nature, that they have no reason, at least that they're not willing to see, to distrust them because they grew up their whole lives trusting these institutions. But the truth is, at the end of the day, they're all businesses, right? If a hospital doesn't have any sick or injured people coming in, it doesn't make money. And then there's no money for them to continue to grow their operation, continue to invest in scientific discoveries and new procedures. You need money. Money is the lifeblood of business, right? And if the money's not flowing in, they can't continue to develop new cures, develop new methods for doing surgeries and things like that, which will advance Western medicine. So it's sort of a double-edged sword, because if people are always healthy, you won't be able to continue to explore and evolve the science of how to help people. But at the same time, if, they're healthy, they don't need those things. So, like I said, it's a double-edged sword. You almost want people to always be healthy so that we can all thrive. But at the same time, you do want to fund these medical institutions so that we can continue to make new discoveries and continue to progress in the medical industry, so that maybe one day there's no incident, injury, or illness that doctors and scientists cannot cure. So, we're going to definitely see a big shakeup in the medical industry over this, especially with the confirmation of RFK Jr. Once he does get confirmed, he's going to make some changes. It's going to change the medical industry as a whole, hopefully for the better. And that's, I think, what most people believe he's going to do, because he's based his entire life's career off of going after corrupt big corporations that care about profits and money over the people. And, so many other environmental things that he's done that has actually helped. There is a lot of environmental stuff that's nonsense, that's just a way to line politicians' pockets. But I think sometimes people get so conspiratorial that they think that that's the way it is for everything. Yeah, but, New York City used to be highly polluted in the 60s and 70s. It was a disgusting place with a lot of pollution that was, not good for people. And people like him have helped clean it up over the course of the last few decades, to now where, yes, it's still a city, so it does still accumulate a lot of, pollution and dirt and things like that, trash and stuff like that. But it's gotten better because of certain regulations. So there are some good things that come from environmental regulations in order to, help preserve the planet and help protect people's health. But there is also stuff that's not good that hopefully people like him and people like Trump will cut out of the way, so that, we can thrive again as a nation, but also do it responsibly. I think just recently Trump, quote unquote, turned back on the water in California by getting rid of some environmental regulations that was holding that back. So now the people in California that have been experiencing these wildfires can really get the help they need and the help they deserve. And a lot of bureaucracy was what got in the way of that. It was really politics, not, the fact that global warming or, money or whatever. They had all the resources that they needed. They chose to implement certain environmental regulations and certain liberal policies that ended up hurting the state long term, because now all this damage was done. Now, you can argue whether or not there was an agenda with that and it was done on purpose, fine, but either way, it was still done. And I think Trump just reversed some of that stuff, so now the people can get the help that they deserve and that they need. But let's take a look at this confirmation hearing with RFK Jr. It's live right now at the time of this recording. So, he is undergoing that process today. Will he be confirmed today? I don't know. But let's just see some of the questions and things that they're asking him as he undergoes this confirmation hearing.
For a moment, as we discussed in the meeting we had in my office, mifepristone was approved in 2000. The FDA has been under scrutiny and brought to court for failure to properly assess this drug, as well as subsequent deregulations Senator Langford described that have occurred over the past 25 years. Some of these deregulations included ending the requirement that these drugs be prescribed by a doctor, ending reporting requirements for adverse events, and allowing these pills to be obtained through the mail. In fact, the FDA's own prescribing label mentioned that 3 to 5% of women taking this drug end up in the emergency room. My question is, if confirmed as Secretary of HHS, will you commit to working with the FDA Commission to review these deregulatory actions that are threatening the safety of women?
Sorry, Senator. As I said to Senator Langford, I think it's immoral to have a policy where patients are not allowed to report adverse events and where doctors are discouraged from doing that. President Trump has asked me to study the safety of mifepristone. He has not yet taken a stand on how to regulate it. Whatever he does, I will implement those policies, and I will work with this committee, make those policies make sense.
Thank you, Mr. Kennedy.
Senator Hassan.
Thank you, Mr. Chair and Ranking Member Wyden, and welcome, Mr. Kennedy, and to your family as well. I want to start with a couple of concerns I have, and just briefly on Medicaid. States share in the funding of Medicaid. Millions of disabled children in this country are alive because of Medicaid. Millions of people with addiction in this country are in recovery because of the services provided to them by Medicaid. And millions of chronically ill people who, until Medicaid expansion was enacted, who couldn't get health care and therefore couldn't work because they were too sick, got health care through Medicaid expansion, then went back to work, and now they're on private insurance. So those are some facts about Medicaid that you might want to brush up on. Now, I'm also extremely concerned about your endorsement of radical fringe conspiracies that, if implemented at HHS, would put American families' lives at risk. Vaccines are one of our greatest public health triumphs. And you don't need, I'm not talking about abstract medical science. One of the people who helped raise me was my grandfather, who was a pediatrician. He practiced medicine in this country from 1921 until the mid-1980s. And I heard details about the difference those vaccines made in saving lives in the children who were under his care. Vaccination has helped to eradicate many deadly diseases in the United States, including polio and smallpox, something we should be proud of as Americans. I am extremely concerned that as Secretary, you would be able to halt critical vaccine research and to exploit parents' natural worries by advising them not to vaccinate their children. This will lead to more children getting sick, and some will even die. Before the measles vaccine, about 500 American children died a year from measles. This is too much of a risk for our country, and there is no reason that any of us should believe that you have reversed the anti-vaccine views that you have promoted for 25 years. For example, you have previously falsely suggested that the polio vaccine killed many, 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 many more people than polio ever did by causing fatal cancers, while rigorous safety studies show that to be completely false. Now, let's go to something we agree upon. I am really heartened to see that one area where we agree on is on women's reproductive freedom. In your own words, it's not the government's place to tell people what to do with their bodies. You said that, correct? Yep. Mr. Kennedy, in 2023, you came to New Hampshire and said, quote, "I'm pro-choice. I don't think the government has any business telling people what they can or cannot do with their body." So you said that, right?
Yes.
Yep. But you also said we need to trust the women to make that choice because I don't trust government to make any choices. You said that too, right?
Yes.
It is remarkable that you have such a long record of fighting for women's reproductive freedom, and really great that my Republican colleagues are so open to voting for a pro-choice HHS secretary. So, Mr. Kennedy, I'm confused. You have clearly stated in the past that bodily autonomy is one of your core values. The question is, do you stand for that value or not? When was it that you decided to sell out the values you've had your whole life in order to be given power by President Trump?
Senator, I agree with President Trump that every abortion is a tragedy, that we can't be a moral authority in this country.
Right. So, but that isn't what you said back in New Hampshire in 2023. My question is exactly when did you decide to sell out your life's work and values to get this position?
Senator, I agree with President Trump that every abortion is a tragedy.
So what you're telling us, just to be clear, because my time is limited, is that regardless of what you believe, regardless of what values you have, if President Trump tells you to do something, you're going to do it. You said just now the discussion about mifepristone. Oh, he's asked me to study the safety of it. Here are the safety studies that tell us mifepristone is safe and effective. And I asked Mr. Chair that these about 40 studies be admitted to the record by unanimous consent.
Without objection.
So the studies are there. The safety is proved. The science is there. But what you're telling us is if President Trump orders you to take action to make it harder for women to get direly needed health care, you'll follow his order. If Mr. Trump, as he did yesterday, orders a halt on Medicaid payments that are essential for taking care of people with disabilities all around this country, you're going to follow that order because you are willing to sacrifice your values, your knowledge, if President Trump tells you to do that. That, to me, is unacceptable in a Secretary of Health and Human Services.
As I explained before, the White House has issued a statement saying that that policy will not deprive any American of benefits.
The problem is the White House issued that statement only after we pointed out the damage it would do, and it became politically uncomfortable for them. You know what else that freeze on federal funding did? It halted funds for critical research that could cure pediatric cancer. So if the president tells you to do that, you're going to stop that too. That's enough.
Thank you. Senator Cortez Masto is next.
Thank you.
So with just right out of the gates, take a look at that. I've said this in the past on these videos. There is a war in government. You have a war between the Democrats and the Republicans. Based on a lot of it is based on ideology, how they see this country going in the future. And the Democrats want it to go one way, and the Republicans want it to go another way. Now, don't get me wrong. Both sides have people that are turncoats to their own team, right? The Republicans have rhinos, and the Democrats have people who are really more independent, moderate, that don't, they're more like the JFK Kennedy generation Democrats that are, have conservative values, but at the same time, they also do believe in some liberal progressive policies. And the Democrats don't like those people because they feel like they're not as radical as they should be in order to be with the modern day party. And the rhinos, the conservatives, the true conservatives don't like because they feel as though, or at least this is what they show their own team by being, is they believe in certain conservative values, but they're also really pretending to be conservatives. That's why they call it Rhino Republican in name only. And their real goal is, worrying about the big corporations, being a warmonger, things that the American people don't want. True Americanism is not about trying to conquer the world and be like the next Great Britain or the next ancient Rome. It's us governing ourselves and having freedom within our own country, and then just protecting ourselves from other countries in the world trying to conquer us. But it's not to go out there and be, take over every nation and be king of the world. That's not what America was founded on. That's not what this nation, at its core, believes in. So there is a war in government between these two, but there's also, so there's the Republicans and the Democrats, but there's also sub categories, I guess you could say, of that, where you have the conservatives that are inside the Republican Party that don't agree with everything that the Republicans are doing because there's a lot of rhinos fighting with them. And then there's the Democrats that have, like I said, the more moderate people in there, and then the more radical liberals in there. So there's a lot of fighting going on between the two parties, but then there's also a lot of infighting going on within their own parties. So that's a good thing. That's exactly how you want the government to be. See, so a lot of people think that's a bad thing. It's not. The government, this is why everything was designed the way it was by the founders. Even when the founders put this country together, they had very different beliefs, very different political beliefs, very different policies that they believed should be implemented into the governing system. They were at war with each other at certain points. It was hard for them to even get to the Constitution. That's why it took so long to put the Constitution together, because they were constantly differing on their opinions of how the government should be constructed and how America should be, put together on paper. And that's great. That's what you want. That's why it's so hard to get things into law. And there's 3 branches of government. There's all this red tape on purpose to make it difficult, so that if everybody finally gets to the finish line, the country as a majority agrees that this is what they want. And at least, even if there's a few outliers that don't, the majority have spoken, but not just the majority isolated in certain locations of the country, like the cities ruling the whole state. No, the states individually and then collectively as a nation have agreed this is how they want to see the nation move forward. So this is a good thing that there's all this infighting going on in the government. We actually want this. But it's funny because RFK Jr. is a Democrat. He was a Democrat. He left and became an independent, but he was always like a Kennedy Democrat from, the way that his father and his uncle would have been during the 60s and 70s when they were basically, big and sort of reinvented the Democrat Party. That's where RFK Jr.'s politics stands. He's a traditional Democrat. He's not like these progressive liberals today. So it's kind of funny to see a lot of these Democrats that are in office attacking him on some of his policies and beliefs, when his whole life he was a Democrat. His father, his uncle, all Democrats, huge part of the Democrat Party, way before any of these people that are on the panel today were involved in this Democrat Party. And it's funny to see them attacking him now because he's joined forces with Trump. That doesn't mean he changed his opinions or beliefs. He just admitted right there he's pro-choice. Donald Trump is not pro-choice. So he hasn't abandoned all his beliefs and aligned with everything that Trump is about. He has decided to join forces with him for the good of the nation. And he said in previous events that he believes he was called by God to do this. So this is good. This is all good that everybody's kind of, attacking each other and fighting for, the way this nation's going to look going forward for the next 4 years under Trump's term, whether or not all these people get confirmed. I have a feeling they're all going to get confirmed because none of them have any, anything wrong with their character or with their past that would make them unqualified legally to be in this position and to serve. But I wanted to point that out because it's funny that he is and was his whole life a Democrat. He just recently switched last year to the independent, to be an independent. And these Democrat politicians are going to rip him apart today, even though he was on their team his whole life, only because within the last year he joined forces with Trump. Amazing.
Thank you for coming into my office and having the conversation that we did. I appreciate your passion and your belief, and you've spent years really talking about the issues that matter to you, and I appreciate that. Let me ask you a couple of questions, though I just need some clarification. Right now, there's a 40-year-old law that requires hospital ERs accepting payment from Medicare to actually provide emergency care to patients. So let's say a woman experiencing a life-threatening condition like a heart attack goes to the ER. As a lawyer, you would agree that that federal law protects her right to emergency care, correct?
Yes.
So now a pregnant woman with life-threatening bleeding from an incomplete miscarriage goes to the ER. Let me rephrase that so you can hear. A pregnant woman with a life-threatening bleeding from an incomplete miscarriage goes to the ER, and her doctor also determines that she needs an emergency abortion. But she's in a state where abortion is banned. You would agree also as an attorney that federal law protects her right to that emergency care, correct?
I don't know. I mean, the answer to that is I don't know if the state
Does it,
bans
well, let me ask you this as an attorney, doesn't federal law preempt state law?
The federal constitution does. Sometimes not every federal law preempts state laws. It could be unconstitutional. Now, I'm
Well,
not
I would
trying to
tell
be
you in this
evasive,
case, let me ask you
Senator. I'm
this.
just telling you I don't know the
I
answer to
appreciate that.
question.
But what authority do you have over this as the director of HHS
What authority do I have?
to enforce the law?
In what regards?
To make sure that a hospital that receives payment from Medicare is ensuring that they're providing the necessary emergency care to patients when they present. It's actually the EMTALA law. So what authority as HHS director do you have with respect to EMTALA?
My understanding is that I have budgetary power and that it's pretty much limited to that. But if you tell me I have another authority, I don't even think that
Well, let me tell you,
we have
you
a
do.
law enforcement branch at HHS.
Actually, you do, and that's CMS. CMS actually investigates complaints of EMTALA violations, as well as the Health and Human Services Inspector General, who, by the way, was just recently fired by Donald Trump. So you will be enforcing EMTALA laws, and it's important that you understand their impact and don't play politics with the patient presenting at the ER based on a position that this administration has taken. Let me ask you another question. When we met in my office, you said about lowering drug prices, that when Big Pharma price gouges, the American people suffer. I think we both agree on that. And I think you're sincere in your belief that you want to reduce prices for Americans, correct?
Yes.
Yeah. The Inflation Reduction Act empowered Medicare to negotiate prescription drug prices. It penalizes drug companies for price hikes above inflation, and it caps seniors' out-of-pocket drug costs, along with reducing insulin prices to $35 per month. But your future boss, Donald Trump, on his first day in office, revoked President Biden's executive order that actually directed the health secretary to examine ways to reduce drug prices and improve access to innovative therapies for the American people. And unfortunately, Republicans in Congress to repeal the Inflation Reduction Act, which means reversing all of those things that we worked on to lower prices for Americans. So my question to you is, what do you do? Why are you there? Are you there to be a rubber stamp to this administration and cave into all of these positions that they're taking, even though you know they're in disagreement with your positions on lowering drug prices and that they could harm Americans? How do you handle that as HHS director?
Senator, my understanding is that the White House issued an executive order, I believe today, supporting the drug negotiations under the IRA. President Trump was very aggressive during his first term about negotiating drug prices. He has instructed me, and I've met with him repeatedly on as that we need lower prices than seniors in this country, and
So let me ask
others
you,
are.
let me ask you this, because I only have so much time. So we've already negotiated lowering prices for 10 drugs with Big Pharma. And Big Pharma, by the way, opposes this. They have not only are asking for a pause, they have filed lawsuits, but we've already negotiated the first 10 drugs. And we want to expand it to the next 10 to 15 that the Biden administration has put forward. Would you agree and continue that path of really mandating that big pharma come to the table and negotiate drug prices for Medicare so we can lower those prices for Americans?
My understanding is that the executive order that was issued today, which I haven't seen, but I've read a summary.
Well, let me ask you this then, because you keep citing the Trump administration and you're just going to follow what they say. Is that what you're doing? You're just a rubber stamp for them in this position? So anybody,
Trump.
so it doesn't matter that you're before us. It could be anybody coming before us as long as they're a rubber stamp for this administration and disregarding your beliefs and what you think. I guess my question to you is, if it really is fundamental to what you believe, how do you live with that? How do you address those issues moving forward,
You want me to
knowing
answer
that
the
it's going to
question,
harm
Senator?
Americans? Yeah.
You want me to answer the question?
No, I'm asking you.
Okay. President Trump has asked me to end the chronic disease epidemic and make America healthy again. And I'm
So
in a
is that the
unique
only reason why
position.
you're at HHS? Is that the
Excuse
only
me?
reason why then you're at the HHS, to address that one issue?
President Trump has asked me because I'm in a unique position to end that. And that is what I'm doing. And if we don't solve that problem, Senator, all of the other disputes we have about who's paying, and whether it's insurance companies, whether it's providers, whether it's HMOs, whether it's patients or families, all of those are moving deck chairs around on the Titanic. Our ship is sinking. Our 60% increase in Medicaid over the past 4 years is the biggest budget line now, and it's growing faster than any other. And no other nation in the world has what we have here. No other nation has a chronic disease. We have the highest chronic disease burden of any country in the world. We had, during COVID, we had 16% of the COVID deaths in a country. We only have 4.2% of the world's population. We had a higher death count than any country in the world. And when CDC was asked why, they said it's because Americans are the sickest people on earth. The average person who died from COVID, American, had 3.8 chronic diseases. This is an existential threat economically to our military, to our health, to our sense of well-being. And it is a priority for President Trump. And that's why he asked me to run the agency. And if I'm privileged to be confirmed, that's exactly what I'll do.
See, a part of me wonders if they all get in a room together before these hearings and see if they could come up with like a strategy to attack the person being confirmed. Because there's a lot of uniformity in the way that they ask their questions and the tactical approach that they take when, dealing with him. First of all, they hit him with one question after another without letting him respond. It's almost like a boxing match. They're hitting him with a couple of, jabs before they do what they think is their knockout punch. And they're doing the jabs to weaken him to get ready for the big knockout punch that hopefully will end the match. That's sort of how they operate, especially in these type of situations, which I've seen many of these before, and they all seem to do the same thing. They're trying to make him look uncredible and unfit for this position. But the truth is, he's probably, with his background, his career, his resume, he's probably more qualified than any of them up there, not only for their positions, but for the position that he's trying to take as well. A lot of these people came from, just typical backgrounds. They had a good job. They did decent things in their career life. And they, somebody got in their ear and told them to run for politics and that they would back them, and they did, and they won. And a lot of these people are just everyday Americans, right? And that's really the only qualification that there is. So I'm not saying that they're unqualified for their positions in that way. But his resume, his background is extensive. Not only does he come from the Kennedy family, one of the most notable families in American history at this point now, but he has done, like I said, a lot of big things in his career as a lawyer. And he's gotten a lot of big case wins that set precedents in the legal world. So he's absolutely qualified to do this job. Not to mention, he's had a passion about health his whole life, taken it seriously, and applied it not only to his career life, but to his personal life as well. So he's very well rounded and he's very qualified for this position. And he has a passion for actually helping solve the problem that we're having in this country in terms of health and wellness. But he's not, he doesn't seem like an extremist, like some people could be very extreme with it, where all they want to do is have everybody go back to, eating grass and living off of the herbs. That would be too extreme for America. But he's not looking to do that. They're making him out like he's some conspiracy nut that's trying to implement his wacky ideas into the government system, into the American government. But the truth is, he's just trying to get to the bottom of a lot of these problems that we're having, and a lot of them, include things like the state of food in this country, our diet, the vaccines, yes, the medical industry as a whole, a lot of corruption there. So they're trying to make him seem like he's an idiot. He doesn't know what he's talking about. He doesn't even know, what he's legally allowed to do or not legally allowed to do. But he's been a lawyer his entire life. Clearly he's going to know, he's going to study the laws and he's going to know what he can and cannot do. And I think they're also trying to make a divide between him and Trump, make him out to be as though he's a puppet for Trump, and that Trump is pulling him on his strings. And I think they're trying to hit his ego to make him rebel against Trump and act as though, no, he's going to do what he wants and Trump's not his ruler, his master. I think it's all psychological. I think they're trying to get in his head and make him think or rebel at least against Trump. So that's probably the tactic here. And it doesn't seem like it's working. He's saying that he was put in this position to make America healthy again. That's what he intends to do. And once he does that, he'll figure out the rest of these little insignificant details later. But yeah, it just seems like a little bit of a psychological strategy from their end.
Senator Barrasso.
Thanks so much, Mr. Chairman. Mr. Kennedy, thank you for taking time to visit with me in my office prior to today's hearing to talk about a lot of the important issues affecting healthcare in my home state of Wyoming as well as the nation. And I appreciate your willingness to serve our country. During our meeting, we discussed the challenges that healthcare providers and patients are facing in rural America, financial obstacles facing rural hospitals, workforce shortages, issues of OBGYN, and then new regulations that are painful that have come out of the Biden administration, hurting our ability to provide nursing home staffing. So let me start, if I could, with rural hospitals and the closures of hospitals like that. There are a lot of challenges facing hospitals in rural communities and frontier areas. We have 33 hospitals in Wyoming. 26 are really located in various locations, often hard to get to. Weather impacts them. 6 of the hospitals are at risk of closing. 2 are at immediate risk of closing in the next 2 years. 10 have had to cut available services. And this is a concern of rural hospitals, both Republican and Democrat states, either way, bipartisan. Critical that the workforce challenges, financial challenges that we're facing are addressed. Can you commit to working with us on a plan to address the critical nationwide issue of rural health care?
Yes, yes, Senator. And I would say that during my visits, I visited almost 60 senators so far. And the most common unifying, I would say, issue among both Democrats and Republicans, there were 2. One was PBM reform, and the other is rural hospitals. And, our nation made a commitment over 100 years ago to put up a hospital within 30 miles of every American. We generally succeeded in doing that. It's absolutely critical. It's life-saving. And rural hospitals are closing at an extraordinary rate right now. They not only provide important health care for the localities, but also they're economic drivers for localities all over this country. President Trump is determined to end the coverage of rural hospitals, and he's asked me to do that through the use of AI, through telemedicine, which these are innovations that I saw the other day. A Cleveland clinic has developed an AI nurse that you cannot distinguish from a human being that has diagnostics as good as any doctor. And we can provide concierge care to every American in this country, even those, the remote parts of Wyoming, Montana, Alaska, et cetera. We also have opportunities at HRSA and at the GME to finally live up to GME's mission of providing personnel to rural hospitals. And I intend to use all of my power, because I've seen the priority that is given by both Democrats and Republicans on this committee. I intend to make that a priority if I'm privileged to be confirmed.
Well, I appreciate it, because often with financial strains on a local hospital, one of the common services to be cut in rural hospitals and maternity services. And now we have women in Wyoming having to drive over 100 miles to access care. 13 counties in Wyoming don't have access to OB. And we're talking counties larger than the states of Vermont, New Hampshire, Rhode Island, Connecticut, New Jersey, Delaware, counties larger than those whole states. So will you commit to working with my office to find solutions to help address these specific maternal health challenges in rural America?
Yes, Senator, I look forward to it.
Another issue we specifically spoke about with this harmful Biden administration rule that have really been bad for our rural nursing homes. And it's a rule that would triple the registered nurse requirements in nursing homes. This is going to lead, there just aren't enough registered nurses in our state to be able to comply with this. This would lead to nursing home closures across our state. Will you commit to working with me to fix this serious problem as a result of a rule that came out by the Biden administration, who clearly doesn't understand rural America?
Yes, Senator, I think the rule was well-intentioned, but as you've said, and I've heard from many rural senators, it will be a disaster for their states. Some of the nursing homes, these are staffing rules that require 24-hour staffing by medical professionals. Some of the nursing homes in rural areas simply do not have the available personnel or the economics to be able to do that. It will mean the closure of nursing homes in rural areas across our country, which means the parents, the elderly parent, will be moved a great distance from the local community and their family. And we know that the single greatest driver of high quality nursing home care is the involvement, the proximity of family members. When you move that nursing facility away from the community where the kids live, you're going to get much worse care. So the intention, although it was noble, was in reality, for rural areas at least, it is going to be a disaster.
Thank you. Thank you, Mr. Chairman.
Thank you. Senator Johnson.
Mr. Kennedy, welcome. Thank you for being here. Thank you for your decades-long advocacy for a clean environment, for children's health. I can't say as I'm surprised by the hostility on the other side. I'm highly disappointed in it. I don't know if you remember when you called me up and you were contemplating setting your political differences aside, joining forces with President Trump on an area of agreement, addressing chronic illness, trying to find the root cause of all these problems facing this nation. My first response was, Bobby, this is an answer to my prayers. We need to get to the answers of this, but even more, we need to heal and unify this divided nation. I'm not necessarily the most optimistic guy because we've got enormous challenges facing this nation, but I thought, wow, here's somebody from the left, somebody I don't agree with on many issues politically, coming together with President Trump and focusing on an area of agreement, something that the American people desperately want. Finding out the answers. What has caused autism? What is causing chronic illness? Ms. Kennedy, I think I've come to know what's in your heart. I think I know the personal and political price you've paid for this decision. I want to say publicly, I thank you for that. I truly appreciate what you're doing here. can't we come together as a nation and do this? Can we do? Aren't you getting tired of this? I'm getting tired of this. So again, Mr. Kennedy, I need to enter in the record. These are just 11 letters of support signed by 63,000 people, thousands of doctors. From the American Association of American Physicians and Surgeons, Independent Medical Alliance, the North Carolina Physicians and Freedom Group, Governor Jeff Landry from Louisiana. These are Americans, nonpartisan. A lot of these people I know because I've advocated with you. A lot of them are Democrats. They put their political differences aside. So, Mr. Chairman, I'd like to enter this in the record.
Without objection.
I also do want to, Mr. Kennedy, as long as I have you here, I've written over 70 oversight letters to the federal health agencies under the Biden administration. I've virtually gotten squat them, okay? What I get is we get, for example, 50 pages of Anthony Fauci's emails redacted. Oh, by the way, the latest one was 17 pages. Instead of issuing a health alert on the myocarditis they knew was impacting young men early in 2021, instead of issuing an alert on the Health Alert Network, they developed 17 pages of talking points. This was given to the public under a FOIA request. They had to go to court. They've got a new way of redacting. They don't black things out. They just give you white pages, so you don't even know what they have redacted. So again, I've issued a subpoena now to cover the information I've requested in 70 oversight letters. My question to you is, as Secretary of HHS, will you honor these requests from Congress, and will you make HHS transparent?
Yeah, my approach to HHS, as I said before, Senator.
So that's a good point that congressman was bringing up. They redact information from documents, government documents, when the people request it through the Freedom of Information Act, which gives us the right to request basically anything from the government, and they have to be transparent with us and give us what we're looking for. The only time they're really allowed to redact something if it's a national security concern that is currently a national security concern, or an open investigation, something that they're currently working on that they can't have their case basically and their evidence exposed to the public, because the party that they're going after could potentially find out what they know and then figure out how to, I don't know, skirt around it somehow, depending on, obviously, each situation is different. But if it's not an open case and it's not an active threat to Homeland Security, then there's absolutely no reason why they should be keeping information from the American people unless they're guilty of something. And if they're guilty of something, of course, they're not going to want it to get out there. But that's the American people. This is a congressman. He's part of the government. When he requests information from a non-elected governing agency, typically a lot of the three-letter agencies, the FBI, CIA, other three-letter agencies that are not elected positions, that are not in the Constitution as actual positions that are part of the government, that is, because the Constitution breaks down what makes up the government and what positions are actually supposed to be filled. And anything else after that hasn't been added with like an amendment or something to the Constitution, putting it in the official governing system for this country, could be considered unconstitutional and null and void. And that's where we get into this situation with these three-letter agencies, not being elected officials. And so technically they have no governing rights over the people. But for them to deny a congressman information that they're requesting is highly unconstitutional. You have to one branch of the government is not allowed to tell another branch of the government, no, we don't work for you. We're going to do whatever we want, and too bad. No, they all work together. They all work to balance each other out, you know? So for Congress, which basically has the most power because they're the ones that basically put together the laws, and they're the ones that are to hold the executive branch accountable and the judicial branch as well. Um, you can't deny them if they request something, again, unless it's a you know, national security threat or an active investigation. You're not supposed to deny them and redact information from these documents when they request it. You have to give it to them. And the fact that they're not, they're basically acting in a treasonous way. The government is not allowed to do that. And especially a non-elected official that is working in a part of the government that's not actually lawfully a part of the government under the Constitution. So you're basically a private citizen at that point because you're not constitutional. Your organization is not constitutional. So technically you're not part of the government. But and you're telling a government, an actual official government person that it was elected by the people, you're telling them no. I mean, you know, that is unlawful on so many levels. The fact that Congress puts up with this and doesn't actively go after these three-letter agencies and start charging them with crimes is, you know, either they're in on it and it's a, you know, big treasonous conspiracy, or the corruption is just so widespread it's hard to get anybody to join forces and go after these people. But hopefully now that Trump's in office and he's changing a lot of things, especially after Kash Patel gets confirmed, hopefully they will start cracking down on a lot of this behavior because it is absolutely treasonous. And, you know, a real lawful court that doesn't have a corrupt judge or a jury that has been manipulated will find these people guilty of these crimes, because all you have to do is go and look at our founding documents and discover that a lot of what they're doing is unlawful. But yeah, that's, you know, if you notice too, the last two congressmen that spoke to him were very fair. They asked him questions and they gave him a chance to answer. They weren't trying to ambush him. They were genuinely trying to see, hey, is this something that you're willing to do? Because this is a concern as a congressman that I have and that my constituents have. And he answered those questions. So that is the way that they should be conducting themselves. These other politicians that are against him, they're probably against him because the lobbyists that put pressure on them, that also line their pockets, are, you know, basically telling them you have to do everything you can to not let this person get confirmed, which is probably not going to happen at this point because Trump has the majority of Congress now anyway. But yeah, it's just, it's interesting to see. Like I said, it is good in certain ways. It's not all bad, but it is interesting to see. And I think the people, more importantly, are behind RFK Jr. There's been a movement in this country for health and wellness for the last 3 decades, really. And he's been a big part of that as well, with many other people that I can actually see there in the back in the audience. I think he's going to get confirmed probably today, if not today, sometime this week for sure. But we'll see how this unfolds.
Radical transparency. Democrats and Republicans ought to be able to come in and get information that was generated at taxpayer expense, that is owned by the American taxpayer. They shouldn't get redacted documents. Public health agencies should be transparent. And if we want Americans to restore trust in the public health agencies, we need transparency. I want to say something about what you first said. When I launched my campaign, it was about uniting Americans, Democrats and Republicans. There's no issue that should unite us more than this chronic health epidemic. There's no such thing as Republican children or Democratic children. These are our kids. 66% of them are damaged. I know what a healthy kid looks like because I had so many of them in my family. I didn't know any of the food allergy growing up, peanut allergy. Why do 5 of my kids have allergies? Why are we seeing these explosions in diabetes, rheumatoid arthritis, neurological diseases, depression, all of these things that are related to toxics in the environment? Why can't we just agree with each other to put differences about so many issues, intractable issues aside, and say, we're going to end this? I don't think anybody is going to be able to do this like I have because of my peculiar experience, because I've litigated against these agencies. When you litigate against them, you get a PhD in corporate capture and how to unravel it. I've written 6 books about these agencies. I know a lot about them and I know how to fix it. And there's nobody who will fix it the way that I do because I'm not scared of vested interests. I don't care. I'm not here because I want a position or a job. I have a very good life and a happy family. This is something I don't need. I want to do this because we're going to fix it. And the other thing is we are attracting now a caliber of people to HHS like never before in history. And they're entrepreneurs, they're disruptors, they're innovators of immense talent that are walking away, many of them from growing concerns. They're not coming there for position. They're coming there because they want to save our country. And they're from across the political spectrum. And all these Democrats are opposed to me for partisan issues. They used to be my friends, agreed with me on all the environmental issues that I've been working on for my whole career. Now they're against me because anything that President Trump does, any decision he makes, has to be lampooned, derided, discredited, marginalized, vilified.
We need to move on. Senator Warren.
Thank you, Mr. Chairman. So, Mr. Kennedy, I want to start with something that I think you and I agree on, and that is that Big Pharma has too much power in Washington. You said that President Trump asked you to, quote, clean up corruption and conflicts. Sounds great. You've said that you will, quote, slam shut the revolving door between government agencies and the companies they regulate. That also sounds great. So here's an easy question. Will you commit that when you leave this job, you will not accept compensation from a drug company, a medical device company, a hospital system, or a health insurer for at least 4 years, including as a lobbyist or a board member?
Can you just repeat the last part of the question? Can I commit
You're
to
not going to take money from drug companies in any way, shape, or form.
Who? Me?
Yes, you.
Oh. Yeah, I'm happy to commit to that.
Okay, good. That's what I figured. I said it's an easy question to start with. And I think you're right on this.
I don't think any of them want to give me money, by the way.
Let's keep going. You're right because to say yes, because every American has the right to know that every decision you make as our #1 health officer is to help them and not to make money for yourself in the future. So I want to talk more about money. I'm looking at your paperwork right now. In the past 2 years, you've raked in $2.5 million from a law firm called Wisner Baum. You go online, you do commercials to encourage people to sign up with Wisner Baum to join lawsuits against vaccine makers. And for everyone who signs up, you personally get paid. And if they win their case, you get 10% of what they win. So if you bring in somebody who gets $10 million, you walk away with $1 million. Now, you just said that you want the American people to know you can't be bought. Your decisions won't depend on how much money you could make in the future. You won't go to work for a drug company after you leave HHS. But you and I both know there's another way to make money. So, Mr. Kennedy, will you also agree that you won't take any compensation from any lawsuits against drug companies while you are secretary and for 4 years afterwards?
Well, I'll certainly commit to that while I'm secretary. But I do want to clarify something because you're making me sound like a shill. I put together that case. I did the Science Day presentation to the judge on that case to get it into court.
Mr. Kennedy, it's just a really simple question.
Yeah,
You've taken in $2.5 million I want to know if you will commit right now that not only will you not go to work for drug companies, you won't go to work suing the drug companies and taking your rake out of that while you're a secretary and for 4 years after. It's just,
I'll commit to not taking any fees from drug companies while I'm secretary.
I'm asking about fees from suing drug companies. Will you agree not to do that?
You're asking me to not sue drug companies.
No,
And I'm not going to agree to that,
drug
Senator.
companies as much as you want.
I'm not going to agree to not sue drug companies or anybody.
So let's do a quick count here of how, as Secretary of HHS, if you get confirmed, you could influence every one of those lawsuits. Well, let me start the list. You could publish your anti-vaccine conspiracies, but this time on U.S. government letterhead, something a jury might be impressed by. You could appoint people to the CDC vaccine panel who share your anti-vax views and let them do your dirty work. You could tell the CDC vaccine panel to remove a particular vaccine from the vaccine schedule. You could remove vaccines from special compensation programs, which would open up manufacturers to mass torts. You could make more injuries eligible for compensation, even if there is no causal evidence. You could change vaccine court processes to make it easier to bring junk lawsuits. You could turn over FDA data to your friends at the law firm, and they could use it however it benefited them. You could change vaccine labeling. You could change vaccine information rules. You could change which claims are compensated in the vaccine injury compensation program. There's a lot of ways that you can influence those future lawsuits and pending lawsuits while you are Secretary of HHS. And I'm asking you to commit right now that you will not take a financial stake in every one of those lawsuits so that what you do as secretary will also benefit you financially down the line.
I'll comply with all the ethical guidelines.
That's not the question. You and I, you have said
You're asking me, Senator, you're asking me not to sue vaccine pharmaceutical companies. Yeah, you are. That's exactly what you're doing.
Look, no one should be fooled here. As Secretary of HHS, Robert Kennedy will have the power to undercut vaccines and vaccine manufacturing across our country. And for all of his talk about follow the science and his promise that he won't interfere with those of us who want to vaccinate his kids, the bottom line is the same. Kennedy can kill off access to vaccines and make millions of dollars while he does it. Kids might die, but Robert Kennedy can keep cashing in.
Senator, I support vaccines. I support the childhood schedule. I will do that. The only thing I want is good science, and that's it.
How about then say you won't make money off what you do as Secretary of HHS?
Before we go to Senator Tillis, I think it would be important for me to make it very clear that Mr. Kennedy has gone through the same Office of Government Ethics process as every single other nominee in the Finance Committee this year and in previous administrations. In addition to listing his assets, including the items that you've identified, he has signed an ethics letter that has been reviewed by the Office of Government Ethics concerning any possible conflict in light of its functions and the nominee's proposed duties. And we have a letter from the Office of Government Ethics that he hasn't complied completely with all applicable laws and regulations governing conflicts of interest.
Mr. Chairman, point of information here. Have we had a single nominee come through who's made $2.5 million off suing one of the entities that it would be regulating and plans to keep getting a take of every lawsuit in the future? Have we had that before?
I haven't reviewed the past documentation of every other nominee's financial interests. And so, no, but I know that every single time we get a nominee, their financial interests are attacked. That's why we have the Office of Government Ethics. That's why they've reviewed everything that's in his record. And that's why he has even, I think, and I don't know that I want to ask him to get into it, but he has listed his assets and has gone through a discussion of the responsibilities under our ethics laws and has complied with all of those requirements. Senator Tillis.
Thank you, Mr. Chairman. Mr. Kennedy, how's your morning going?
So far, so good.
So there you have it. That's a little bit of, we've been doing about an hour of the RFK Jr. hearing today. One thing I want to point out is Elizabeth Warren, people like her in government right now, especially her, she's one of the top radical socialists. And it's funny because there's an irony there. She's a radical socialist who hates capitalists because they go out and they make money and they earn a living off of their own work ethic and abilities to figure out how to make money. And she makes her money by attacking capitalists. And so do a lot of these radical socialist politicians. If you look and see some of the top politicians that make millions investing on the stock market and in other things, and make way more than their salary that they get paid as a government official, are Democrats. Some of the top people on that list, Nancy Pelosi being number one at the top, are Democrats. And they're usually the ones that are radically against the capitalists, but they are capitalists in their own right. They are making money off of sort of manipulating their constituents, the American people, to believe and vote for them. But while they're in office, they're doing shady and questionable things, and making tons of money, much, much more than they're getting paid to be the government official that for the people that they're serving. So it's really hypocritical and it's very ironic. But RFK Jr. is not doing anything wrong in that instance. He's a lawyer. Lawyers make their money by suing people, right? By going after especially corporate lawyers and people in that level. It's a different thing than like an injury lawyer where somebody slips and falls and they build a case around that and they blame, maybe a landlord or somebody for a bunch of things that led to that person slipping and falling. Corporate law is a little different. These people make their money by constantly going after other rich people's money, and they get them on technicalities. They get them on not necessarily, always negligence, like in other situations like accident attorneys and stuff like that, but they get them on technicalities and laws or policies that they're, allegedly breaking. They build a case around it. And it's basically just one rich person stealing from another rich person, and then that rich person steals from another rich person, and it's just the money gets passed around. Corporate law is very unusual. It's very interesting and kind of wild, but also heavily corrupt, but they get away with a lot of things on technicality. So they're not really breaking the law. They're just pretty not great people. They're very let's just say they're not godly people. They're not people that you would trust, and they're really out for themselves in their pockets. But lawyers make their money by suing people, and they somebody like RFK Jr. will find regulations or laws that maybe a big corporation is breaking, and he'll go after that company, and he'll get people build a class action suit or something with people who are affected by that thing and sue them on their behalf, and then he gets a fee for that. There's nothing wrong with that. That's just business. That's American business. He's not doing anything wrong with that, and especially if he wins and gets people who were injured or affected negatively by something paid. He did a service. He did exactly what he got paid to do, a service to help those people who were affected, negatively impacted, get a payout or a payback for something that happened to them. And so Elizabeth Warren is funny. She's not wrong in her question because he has a conflict of interest to a point for this position, as though he is biased in one way. But he is biased in one way. That's why the American people hired him to fill this position, because they like his bias. They agree with his bias, and they're tired of the corruption in the government. However, she's not wrong for asking that question. What's wrong is her hypocrisy, and also she's trying to make him commit to these 4 years that he's with Trump and working in the government, and then another 4 years after he's retired from this position. And that's just a way for her to basically, cripple his income for 8 years in a row. And he would be a fool to say yes and agree to that. Now, while he's in office, no, he should only be serving the American people, and he should not be taking any money from anybody unless he had a deal already in place that he has a contract with them and the contract pays out like maybe, 10 years or something, and it goes through these 4 years that he's going to be serving. Yeah, maybe that money could be put into a trust or something until he retires from this position, and then he could have access to it. I don't really know, but I'm sure it could be worked out somehow. No government official should be making money in the open and free market doing things that directly interfere with their job. Yes, that could be considered a bias where, maybe he does have a racket going where because he has government influence and he can create policies or enact certain things, he can influence his cases to win so that he does get paid out. Now that I don't agree with. No, that's corruption in the government, and no one should be allowed to do that. But that goes for the Democrat politicians that are actively doing that now at the stock market, and they should be in trouble, and they should be, fined, if not brought up on criminal charges for what they're doing. Maybe we'll go into detail in that in a future video because I would like to talk more about business on here, and I think that's a great topic to go into. So maybe the next video or the video after or something, we'll get into the politicians that are using their political influence to manipulate and basically have like insider trading information that benefits them financially. So we'll think about that for a future video. But that's pretty much it for this video. I just wanted to go into a little bit of his confirmation hearing. I have a feeling his and Kash Patel's are probably going to be the most difficult to approve. And they're going to be the most scrutinized because these positions would really, really hurt the Democrats' position and their authority in some of the stuff that they've taken control over the last several decades. So, hopefully these men both get approved, and this is what the American people want. That's why they voted for Trump, and they voted, specifically hoping that some of these people get in. Some people were one-issue voters that basically just wanted to see RFK Jr. get into this position, and that's the only reason they voted for Trump. So I think it's important that these men both get confirmed. But we'll see how this plays out. Maybe we'll do a follow-up video once everybody's confirmed and talk about some of these positions and some of these people and what their plans are for the future of this nation for the next 4 years. But that's it for this video. Don't forget to like, follow, subscribe, share, all that good stuff. It helps the channel continue to grow. And more importantly, put in the comments if you agree with me, disagree with me, if you have any additional take on these videos and these topics. Put it in the comments. Let's have a conversation. And also put in the comments future videos you'd like me to do. But that's it for this video. Stay tuned for the next one. All right, everybody, I just want to take a moment to promote my children's book. This is Little Boy Full of Love. That's me on the back. And this is a little sneak peek on the inside. It's a great book. It's a children's book. I actually wrote this for my son. And it's available right now on Amazon, Walmart, Barnes & Noble, Indigo, Bookshop.org, and a lot of other online platforms. But more importantly to me, it's actually available in a lot of bookstores throughout the country. You can find out which ones are closest to you on my Instagram page. We highly recommend that you shop local, buy from a local bookstore. So if you are looking to, get a children's book for you or anybody you know, or even with the holidays coming up, it's a great time to, buy a children's book as a gift. Definitely get it from a bookstore that's local to you. But if you absolutely can't get it from one of the bookstores that are currently carrying it right now, and we're in about 15 or 16 different states across the country, so it may actually be in your state, and it could even be local to you. But if you can't get it from the physical bookstore, check out our Amazon storefront. The book's available on there right now. And like I said, with the holidays coming up, you may want to do your Christmas or Hanukkah or holiday shopping early, and you can even order it from our Amazon storefront and ship it directly to whoever you're gifting it to. But it's available on those platforms, Amazon storefront and bookstores and other websites that I mentioned. But I want to take a moment here to look at the storefront just to give you an idea of some other stuff that we have available on there. These are products that we highly recommend. They are things that we use in our daily lives, and it's all organized by category. So it's a lot easier to, shop for the holidays and specifically for things that interest you, particular categories. Available right now, many different items on our storefront. If you can see here, 61 items just in women's apparel, fall decor, because right now we're in fall, 26 items, kitchen items, baking specifically, things for around the house, children's toys, even stuff for parties. If you're trying to save money on a party and throwing your own, occasion, you can even buy some cool gadgets here to help you, put on a better party. Health and wellness items here, even stuff for Christmas. And there's the book right there. So you can get it from the storefront. You can get it from the bookstores, like I mentioned. But it's available on all these different platforms. It's really easy to find and gift to somebody. Also, I want to show you the apparel shop, and these are some clothing items that we actually produced. So if you're looking to get some cool apparel items, shirts, hoodies, long sleeve, short sleeve, leggings, even accessories, cell phone cases, women's makeup bags, fanny packs, coffee mugs, all different types of stuff, even some, art, all different categories here, apparel, homeware, accessories, drinks, even digital items. It's all on this store, healthybodygoodssoul.com. Anything that pertains to you or somebody that you're looking to get a gift for the holidays. A lot of great designs on here, a lot of cool designs that we actually custom created. Stainless steel water bottles, especially now with the fall and winter. A lot of cool hoodies and long sleeve shirts. This is a really cool one, I think, for women. The original Be Your Soul apparel, that one's actually really popular. People tend to like that. This one's one of my favorites. The free shirt. It's the American flag and it says free and that says not property of the United States government. That one's pretty cool. Got all different types of tank tops, hoodies, long sleeve, short sleeve, tote bags, coffee mugs, even some items for kids, backpacks. So if you're the type that likes to, plan ahead, I would definitely recommend ordering from the Amazon storefront or the apparel shop within the next couple of weeks to get everything in time for the holidays. Use code SAVE15 on the apparel shop to save 15% off everything on the storefront. So order within the next week or two and you'll definitely have everything in time for the holidays. Definitely check out all the links to everything, the Amazon storefront, the book, and the apparel shop in my bio on all my platforms, Rumble, YouTube, Instagram, Spotify. But you can also find them in all the show notes for every episode that I post and get all your orders in time for the holidays. All right, that's it for this video. Don't forget to like, follow, subscribe, share, all that good stuff. It helps the channel continue to grow. And put in the comments things that you would like me to talk about and make videos on for the future. And I will definitely do my best to do that. Stay tuned for the next one.